Today, my daughter Salish transforms into a doctor. What could possibly go wrong? What? If she passes 7 challenges suggested by fans, YouTube sensation Dr. Mike will get a surprise consequence.
All right, you ready to become a doctor, Salish, or what?
Yeah.
What is this? You gotta look the part. You want some scrubs?
Yeah. Wow.
You look great. Look at this.
I think I have a better idea.
What? Whoa!
Okay, that's cute.
I've been selected as the patient for the day, and the #1 request on Instagram was chest compressions. Salish doing them to me. This is Mike's merch, so go buy it.
Salish, you have 2 minutes, and the challenge starts now.
Do I get to stop him?
No. You do chest compressions first.
Salish will have to pass 4 out of 7 rounds to officially become a doctor and give Mike his surprise consequence.
1, 2, 3, 4. 1, 2, 3.
Did you call for help? Check his pulse.
Ew. No.
No, you don't even. How do you know if he's alive? Oh, that is
He's
not.
alive. 4.
That is not good patient etiquette.
1, 2, 3, 4. He's alive.
You brought him back. Good job. Yeah. Those were some of the worst chest compressions I've ever seen, but there was a lot of effort. The steps were taken in the right manner, so I'm still giving Salish a pass.
This is passing? What do you have to do to fail?
She didn't shock you.
Next round, split pea soup. You know what this looks like.
Okay, this is probably the best part about being a doctor because it's truly about helping patients. Let's go.
Oh boy.
You gotta help the patient. Come on in.
No.
Come on. Yeah, come on. No. You
No.
have student Dr. Salish.
No.
Help the patient.
No.
Why aren't you helping the patient?
No.
They don't feel
No.
good. Help
No.
them. We lost the student doctor.
Doesn't a nurse do that?
No, doctors do that. Doctors who care about their patients. Are you one of those?
No. I'm not cleaning it up, but I know someone who will.
Just breathe through your nose.
I can smell it.
That's okay. It's good practice. There's peas and bacteria.
It was dripping.
The glamorous life of a doctor. All right, Say, how do you think you did?
Terribly.
Yeah, I agree too. Bail on that one. Pass for dad though. For the next round, you have to learn how to get micro naps. Because as a doctor, you get very little sleep. Find those areas where no one can find you.
Okay.
You got 1 minute to find the spot. Ready, set, go. 1,
This room doesn't have
2,
any places.
3,
Maybe right
4,
there. No.
5, 6.
Is the trash a good place? No.
As you all know, I am racing Ben Aslar to 10 million subscribers. I am currently losing. Help me out to make sure I win. I am giving away an awesome prize to a subscriber every single week. Last week, Olivia won the iPhone 13. You could be next. Make sure to subscribe and turn on notifications.
How about these rooms? This one sucks. I could hide further, but no. Under the desk, but no. This one, I could hide right there. Telescope goes off. Oh my God, that was hard. Okay, I'm ready.
59, 60. Ready or not, student Dr. Salish, here I come.
You got 1 minute, Mike, to find her.
1 minute. Is she in this box? She's not. Why is there an ice cream machine in the hospital? She's flexible, so she could be in one of these. 45 seconds. I'm usually better at this. Is she this flexible? No. Oh no. Oh no. Cuckoo! Nope.
Three.
She's too
two,
good.
1.
That's one good hiding doctor.
Salish, where are you?
Whoa! How did you get up there?
I climbed.
She has bright pink scrubs. Like, how did I miss this?
Play that back.
Oh no. This is the biggest pass I've ever seen. Micro nap, Salish is the winner. Student Dr. Salish, are you ready?
Yes.
We are about to perform vitals.
What's that?
You're gonna check the patient's pulse, blood pressure,
Ew.
temperature.
No.
How else will you know if the patient is healthy or sick?
I don't care.
You have the tools here.
Wait, are you in a large adult post?
Does he look like a large adult?
He gained 7 pounds.
Dude. Oh, do we trust her at all to do this?
okay.
You gonna stop this thing?
No, let it go. 120 over 80 is normal.
I just had my blood pressure checked and it was fine.
What is the number? 150 over?
97.
His blood pressure is a little high. He's been running around.
You've
He's
been
a little
stressing me
stressy.
out over here.
What do you think about that, student doctor?
Just don't get stressed out. You're okay. We might need to put you in shock.
What does that even mean?
I don't know, do the shocky thingy.
He has a normal pulse. He's awake.
Cool.
Okay.
No, I think we need to do it again.
You need to check his temperature because if someone's temperature is high, they have a
Fever.
yes, which means it's a sign of a
Thing.
infection. Not in the eye, not in the eye. Yeah, just like that, just like that.
96.6.
Okay, good. He's healthy, doesn't have a fever. You gotta check his pulse, make sure his heart is beating appropriately.
This one?
Yeah.
Put your finger in.
Yep. Less bossy.
It's impossible for her.
65.
Do you think 65 is a healthy pulse, student doctor?
Yeah.
The normal pulse is 60 to 100 beats per minute. All right, student doctor, say you have 1 minute left. You still have yet to check his heart or his
Ew.
lungs using the stethoscope.
Hold this.
Hold this.
Hold this.
She said hold this.
I've never had to hold.
Ew, you spit.
Can you get that for me, or a doctor?
Stop, stop.
What are we hearing? Any murmurs? Any murmurs? Any arrhythmias? Any rubs or gallops?
Ew. Blah.
But his lungs, go to the back. Ask him to breathe deep.
Breathe. Ew.
What does it sound like?
Pretty normal.
Why is it gross?
Because it's him.
What kind of doctor are you training here?
Next, we gotta go to reflexes, but we don't have a reflex hammer. How do you check someone's reflexes without a reflex hammer? Stand to the side so he doesn't kick you when the reflex happens.
That would be funny.
Oh!
Do it to me.
This is just violence now. This isn't even a medical visit.
Sorry about that. Tickle break. No, okay, I have a reflex.
You were really rough with the reflexes, but I gotta say, everything else was pretty on point, so you're gonna get a P from me.
Yeah.
Okay, say, we're gonna mess with your dad.
Okay.
This is a syringe, there's no needle, but I'm gonna distract your dad so he thinks there's a needle.
Okay.
And you're gonna give him like a shot in the arm. Let's go. There's a student doctor that likes to come in. Go ahead,
not
this is your
again.
patient. Please don't look. Please
do
don't
what?
look. Don't look at anything. We're just gonna do a shot.
Oh, a shot?
She's giving me.
What?
Raise it up.
What is what?
The next round is a full patient encounter.
No idea what that is, but I'm scared.
Me either.
Here's a patient, low back pain. What do you do to help them out? What questions do you ask?
Lie down. Now, have you been running? Did you gain some weight? How tall are you? How old are you? 50. Okay. Who's your favorite child?
What? Was that? That's.
You need to tell me.
I don't pick favorites. What?
Maybe does your back hurt because you gained some weight?
Ah! What? No.
Now I want you to go on your stomach, listen to the student doctor.
Ow! I have back pain.
I know,
He's in
I'm
pain.
massaging it all out to get all the knots out.
Where is his pain?
Where's your pain?
My pain is in my lower back.
What causes that?
I don't know. Being old?
Wow.
Good diagnosis. Do you feel any hypertonic muscles?
No. He needs to get a professional massage and you'll be fine. Go get him. Thank you for seeing us. Make sure you pay.
She just hit you with the copay.
That was brutal.
I'm not gonna lie, she put you in the correct positions. There was a lot of good stuff that happened, but because there was an overemphasis on money, I'm saying fail. The values aren't there for me.
Whoa, that's what did it?
This isn't about money. This is about caring for
It's
the...
about money. Make sure you tip me.
Tip?
Yeah, I've been so nice. Just an extra $10. Maybe 100 if you're rich.
Do doctors get tipped?
No, you're rich already. You're a doctor.
Student loans are killing me.
All right, student Dr. Salish, we have a patient here. You're gonna give them their diagnosis or instructions, and sometimes medical words are hard to pronounce. You still gotta do it. Read it out loud with confidence to your patient.
You must be hungry because, and I see that you spelled because wrong. I hear your borborygum.
Borborygmi.
Deoxyribonucleic acid.
Deoxyribonucleic acid, AKA your DNA.
Ophthalmologist. Oh, optometrist. Ophthalmology.
Ophthalmologist.
Oh, that was the last one. I win.
No, that says you fail.
This is the final round. If she passes, awesome surprise / consequence. You're gonna wanna wait. If she loses, she loses. For even more fun and games with Dr. Mike, he is going on tour in April. All the information's in the description. You gotta check him out. He's fun.
Be there or be square. That's the ultimate test right there. She can do the nasal swab that's meant to be done at home. She's an official student doctor.
Nasal swab.
Nasal swab. You got this. You got this. Are you getting nervous?
Yes.
Don't. She's an expert.
Oh!
Half an inch into the nose. Half an inch. Go in a little more. Go in a little more. It doesn't hurt.
The other one.
Go in a little. There you go.
2, 3. Okay.
Actually, that wasn't bad.
Twirl, twirl, twirl. If it's blue, it's negative. Pink is positive.
Okay. Do I test positive or negative?
I tested him before we started.
Oh, it's negative.
Good job. Yes, it's negative. Good job, student doctor. Now, what about that surprise?
Now I get to transform you into a gymnast.
Is that my size, though?
14, 16, perfect.
I'm ready.
And jump into the middle, split, and open.
What?
Touch your toes. Touch them.
I'll try.
Just do a bridge the beginner way. I'll spot you. Class is over. We're locking up. Thank you.
What do I gotta do? Walk home? I'm barefoot.
You should stick to being a doctor.
Do not subscribe to Ben. Subscribe right here. Stay happy and healthy.